Okay, so for this first video for knee, I'm going to go over palpation, active passive range of motion, joint mobility, and then some MMT testing. So first, for detailed palpation, it's going to be a little difficult because my patient has 2 replaced knees, so I'll get like a general idea of where they would be. So coming up approximately along the tibia, I can feel for that tibial tuberosity. And then as I move medially along that medial joint line, I should be coming along the MCL ligament. And I can confirm it by going perpendicular along the knee and feeling for that soft tissue. Just moving proximal to that, I'll be able to feel for the medial condyle. There it is right there. Moving laterally along the lateral joint line, should be able to get a feel for the LCL, which feels like a nice band of rope. And I can confirm by moving distal, I can be on the head of the fibula, and proximally from the LCL, I can feel for that lateral epicondyle. And then just moving along the patellar tendon, I can get a feel for the patella bone, which my patient does not have because he had a replaced knee. But it would be, at least in this area, and I could palpate it by moving medially and laterally. Next up, for active range of motion, go ahead and slide your knee up as far as you can. Good. So that tests for active flexion. Go ahead and kick it out. And that tests for active extension. Passive, just move it a bit more as far as I can until I get a nice end feel. And then moving into extension. Again, just feeling for any pain or any kind of end feel. For special tests, or not for special tests, but for joint mobility, I can do an AP of the tibia on the femur, and I can also go P to A. And then for patellar testing, I can move along a medial glide and a lateral glide, which I can actually feel his patella right here, so I was wrong. And then MMT, go ahead and sit up. And go ahead and let your feet dangle down. For testing extension, I can push into flexion, so kick into my hand. Good. And for testing flexion, I can pull into extension. Don't let me pull your leg out. Good. And that's a pretty basic examination of the knee joint.